Hi everybody, welcome to Kay's Corner, and I'm your host today, Threadmaster Kay, and I'm actually going to spin off today's show in lieu of an Instagram post that came to me. The question was, can you do threads on thin skin? One of my followers actually had asked that they had gone to get a thread lift done, and they were told that because they had very thin skin, that they were not a candidate to get their sutures done. So, saying that, it is a more difficult procedure. It can be a little bit more complex for if you're a new injector or you just recently learned how to do thread lifts. I don't suggest that you try to do it on thin skin first. I always suggest to start your practice with good, healthy skin, mild to moderate sag, and not to go to either very heavy tissue or very thin tissue. So let's just talk about the thinning skin. It does happen. It happens at any age. It could happen for many reasons. But generally, we seem to see this more 50 and older, depending on your hormones, depending on your BMI, your quality of life, and your habits. So even if you have all the best habits in the world, sometimes it's just genetics. So thread lifting is available for just about everyone, but you need to, as a candidate, you need to make sure you choose the right provider. So today I asked my very good friend Annabelle to come and sit with me because she is in that same bracket where I see 50 and older, where we see more thinning skin, and women who actually have to see the truth. They have more time. You are very, very careful with your diet.
Yes.
And you work out.
All the time.
Right? And so that's wonderful. But as we age, we also have the compiled interest of thinning skin, we have low BMI, but we still need to deal with our sagging tissue, whether it's the body, the knees. So we do work out, and working out, we have these beautiful arms. I'm gonna touch you. We get these beautiful firm arms. You know, everything, the skin is beautiful and tight, but there is the issue around the face. So yes, you can get a thread lift when you have thinning skin, but you have to know the right provider, where they were educated, and ask the question, have you ever done thread lift on someone who has thinner skin or a lower BMI, or just, maybe you're 25 or 30 years old and you just love to jog. I found with a lot of my clients who are very active, they just lose weight, so they're gonna lose weight everywhere. In order to do that, you have to pick the right suture. Now, this is sort of industry standard, and this is more for maybe talking about people who might be nurses and doctors who are doing threads out there. Maybe you're only using this one. And this is what I see mostly across Instagram. This is an 18 gauge suture. In industry standard, I mean that the colors that you see here are pretty much the same that you're going to see in any company. So it doesn't matter which company you're using, you're going to see these different tops, okay? Each different color represents a different gauge or a different thickness of the suture. So the idea is to know for the provider which suture they're going to choose if they're doing somebody who has thinner skin or just not a lot of fat on their face, okay? So with Annabelle, she's been with me. How long have we been doing together?
Over a year and a half.
And how did you come to find me? What was the reason you looked for threads?
Well, somebody that I knew was getting threads done, and she looked amazing. And I asked her who she was going to, and she says, I've been to a few people, and Kay is the best.
So you know that I am one of the pioneers here in Canada. My company is just on the tail end of our approval, and a lot more news is going to be coming. So if you like this YouTube show that we're doing together, and if you want to make sure you follow along with my journey on getting the full approval for Health Canada, don't forget to subscribe and hit that button so you get to know your notifications that I'm coming up with a new one. So talking about our sutures with Annabelle, because you can see how slim she is, I would never, ever go with an 18 gauge. And it's not a one size fits all, everybody. So that's one thing I think you as a consumer need to be educated about. If your provider pulls out all these pink ones, you should be a little concerned if you look like Annabelle, because those sutures have a much higher chance of showing through the skin, or maybe they don't show through when you first put them in, but they could eventually be pushed out by the body, because the body looks at the suture. If it's not the right type of suture for the skin, the body will look at it like a foreign object and want to push it to the surface of the face. So pink is a bad sign, okay? Brown could be a bad sign. This is a 19 gauge suture. It's also quite thick, and it's generally used for mild to moderate sag and in healthy tissue. It's not something I would either use on Annabelle's skin. So in her face, if I were to do a mid-face lift on Annabelle, I would be using a 21 gauge suture. In my company, these are V3 cogs. They basically are like, they dissolve in about 18 months. They have a cone shape edge to the barb inside. So each suture has an edge to it that actually catches on the fascia, and we're able to massage the skin and the muscle and the fat pad into place, and it holds there. So if you don't want your sutures to show and you do want to have a nice thread lift, then you're going to go with either a 20 gauge or a 21 gauge. Now, if you're really, really comfortable in using sutures and you're a provider in thread lifting, you could very well go with a 19 gauge under her jawline, but you'd have to really know what you're doing, and the placement would have to be perfect. And of course, that is the only way you're going to be able to get a thread lift, is if you use the right suture. So as a consumer, I hope you can see that you can definitely get a thread lift at any age. Today I'm going to take Annabelle, so this won't be it. We're going to take you into the operatory. I'm going to just give her a little bit more contouring in her jawline, and I'm going to lift her mid-face, and I'm going to bring it up like this, okay? So you're going to see that in a few minutes, and that's, yes, very much, you can have a thread lift if you are lean, cuisine, thin, beautiful, hot, gorgeous lady. Thank you for coming today.
Thank you very much. And I would actually like to add something if I can.
Please
just
do.
Off the cuff.
Please
because
do.
when I first came to you, I was actually 30 pounds heavier.
Yes, you were.
And you dealt with my face then beautifully.
Mm-hmm.
And when I lost the weight, you knew immediately that you had to change the sutures.
That's
and
right.
You explained that to me. And that is invaluable, to have somebody who can look at you at the moment, not just think what they did before, but make the right decisions and have a really great outcome, and not a lot of bruising and not a lot of pain. So thank you for that.
Let's talk about pain though. Let's talk about the pain for a minute. So everybody asks about pain. Everybody has a different threshold for pain. Annabelle is a little bit more sensitive, so you may see that, and that's okay. I want this to be as authentic as possible, okay? I can't just show you, they're getting a thread lift and they're lying there and they're completely comatose. No, for some people, they're going to be a little bit more sensitive, and that's okay. You have to know, as a provider, how to handle that client of yours. I know every single one of my patients. I know exactly what their pain threshold is. I know if I have to give them 1%, 2% with epinephrine or not, hand holding, or just a little bit of a few breaths in between sutures. So there can be, but on average, what would you say your pain out of 10 is though?
Well, the first time it was fairly high.
Yeah.
So I'm going to go with 8.
Okay.
And then the second time it was less.
Do you think that's also to do with anxiety and the unknown and not knowing?
Absolutely could be. And
because you're still here a year later.
And that's what I was going to say. And I keep coming back.
That's right.
And what I appreciate about you is that you know what you're doing, and it's just, you do the business. Let's get it done.
Yeah, the longer you dilly-dally, your provider gets scared, it also doesn't build
Exactly.
confidence in the patient, right?
Yes, so I have full confidence in you. That's why I'm back. And the pain, to me, the last time I was here was much less.
Yes.
Yeah.
And I think in generally people say between 3 and 4 out of 10, and that could be up to 5, that could be up to, like, could be less. It's really very personal, but I would say between 3 and 4 is your average pain tolerance or intolerance level. And now we're going to take her in, so you'll see it for yourself. thread lift is something that you should at least immediately see a 30% improvement when you sit up. And then it only gets better between 4 and 6 weeks. So it takes about that time for the connective tissue to heal underneath. I'm going to pull that skin. I'm going to just pin this loose skin in place. So I start with the blue light. The blue light just takes down any bacteria on the face, especially where we have our little holes. If you look into what blue light and ultraviolet red does for the skin, it's pretty amazing. And I find this just helps to settle the sutures. It's a nice way to finish your procedure. It gives an overall skin tightening, and the blue light, like I said, is for bacteria. It naturally flips over to a red light, and it's warm, and it's ultraviolet red. It's good for healing, discoloration. I find it's just soothing for the patient. It's like a hot stone massage, and it makes sure that all the sutures are nicely in place. So I just want to thank everybody that has come on today to look at thread lifting for slim faces, for thin skin. Thanks for tuning in. I hope you found this helpful, and don't forget to hit that button to subscribe and help me out with my algorithm. Thanks, everybody.
Bye.